I'm Tone's mom. I'm in the middle of my 70s, and Tone has inspired me with all her videos to do exercises. And I want to show you what I do every morning. And I have arthritis in my knees, hip, and my back. So I'll show you. In bed.
And this is the pelvic tilt to strengthen the lower back and all the small muscles of the lower back, and also get the joints of the lower back muscles to move on a daily basis. So and then this is the bridge. And it slowly rolls up and rolls down. Breathing is really important to do so that you keep the tension away, and you also really work with your breath going in and out. And here mom curls the spine to get up, uses her core, and rolls down vertebra by vertebra. Come back. Here she holds her elbow for support and the knee bent to support her spine. This is the oyster. She holds her core strong and lifts the knee up to strengthen the muscles of the pelvis, the gluteus muscles. The slow core. Here holds her core strong and she works her leg and hip muscles. It's really important her hips are over her hips. And she keeps breathing in and out. Circles. Do them slowly because the control is important for both stretch and flexibility. And then flexion, extension of the hip, pumping the hip joint gently, but also softening and loosening up the muscles around the hip. Motion is lotion, we say at Loxiard. Going forwards and backwards. Again, working on her control, working on her flexibility of her hip. And this can be done in your bed before you get up. Once you come up. And again here, flexibility of the spine and the pelvis, where mom holds her core strong while doing this. It also helps to release the lower back. And be careful not to do this if you have an acute back pain or an acute inflammation. This is preventative work. Swapping sides. Keeping the lower leg bent is really important because that supports your spine. You're safe and stable. Go around. So you're just working on the hip flexibility as well as the strength. And strengthening the legs. Remember your core. And circles going in. And circles going out. You can just as well do this outside in your garden if it's warm enough. Get some fresh air. But if you find that it's difficult with stiffness of the joints and aches and pains before you get up, this is a good, gentle way. Always ask your chiropractor before. So we go flexion, extension of the hip. Gently pumping the hip joint. The joints need movement. It's when we don't move our joints that they stiffen up and it's like they freeze up. Doing this is really good for introducing movement, strength, but also body awareness from your brain to that particular joint.
And then the end.
And at the end mom does the plank. And she has done this for a long time, so she will do it with the knees up. She's strong. She does this every day. But if you are starting off, we'd recommend you do with the knees down. And she holds the core strong, her elbows in a triangle, her head, and she keeps breathing through this exercise. Apart from that, Mom also walks every day, and in the summer she swims.
And one more.
One more. But it's lots of variety of movement is how
Squats.
squats. Here it's important that you keep your knees straight. And as you can see, keep the back straight, and the knees and feet are in angle with the hips.
Okay.
Wonderful. Thank you, Mom.